virus affecting the state. The governor is going to give more details in just a few moments, but I want to take the opportunity to introduce the members of our cabinet who are here today. We have the Secretary of the Department of Health, Bobby Neal. We have our Deputy Secretary for Public Health Services, Fran Phillips. We have Secretary of the Department of Transportation, Greg Slater. Secretary of the Department of Human Services, Lourdes Padilla. We have the Secretary for Department of Aging, Rona Kramer. The Secretary for the Department of Budget and Management, David Brinkley. Our Superintendent, State Superintendent of Maryland Public Schools, Dr. Karen Sammons, as well as Executive Director of the Maryland Emergency Management Agency, MEMA, Russ Strickland, Executive Director of Maryland Aviation Administration, which oversees BWI, Ricky Smith, and our Acting Superintendent of Maryland State Police, Jerry Jones. At this time, I'd like to hand this over to the Governor, Governor Larry Hogan.
Thank you. Well, good afternoon. We are here at the State Emergency Operations Center of the Maryland Emergency Management Agency, located at Camp Frederick, in order to provide Marylanders with a number of important updates regarding COVID-19, the novel coronavirus, which has become a major public health issue around the globe. The state of Maryland has been taking this issue extremely seriously. A month ago, at my direction, our administration initiated actions for the preparation and mobilization of all necessary resources in order to address the coronavirus. State health officials immediately began working with the CDC, NIH, and other federal agencies and officials, and with local health departments, hospitals, and others to activate an aggressive and collaborative response. 3 weeks ago, I convened and led a meeting of top federal officials and nearly all of America's governors on the coronavirus in Washington, where we received a detailed briefing from CDC Director Dr. Robert Redfield, Ken Cuccinelli, the Acting Deputy Secretary of the Department of Homeland Security, Dr. Robert Kadlec, the Assistant Secretary for Preparedness and Response at the Department of Health and Human Services, Dr. Anthony Fauci, the Director of the National Institute of Allergy and Infectious Diseases at NIH, and Dr. Jay Butler, the Deputy Director for Infectious Diseases at the CDC. And yesterday, I met with Brigadier General Michael Talley, the Commanding General of the U.S. Army Research and Development Command at Fort Detrick. Just a few moments ago, I held a cabinet meeting with top officials in our state government to review the latest up-to-the-minute efforts in our ongoing preparation for and coordinated response to the coronavirus. And I was just a few minutes late for this press conference because I just got off the phone with Vice President Mike Pence, who is leading the response at the federal level. And I was very pleased that the President made the decision yesterday that Vice President Pence will be leading this effort at the federal level. As a former governor, Vice President Pence understands the importance of a coordinated response, and we agreed to keep in close contact in the weeks ahead. Earlier today, 2 Marylanders who recently traveled to China met the CDC criteria and are currently being tested for the coronavirus. Our administration's first and most important responsibility is keeping Marylanders safe. And while there is not yet any immediate public health emergency here in our state, let me repeat that. There is no immediate public health emergency here in Maryland. Based on the latest guidance from the CDC and our federal partners, we want our citizens to know that all levels of government are working together proactively and taking every possible precaution to respond to potential threats of public health. In just a few moments, our Deputy Secretary for Public Health Services, Fran Phillips, will provide a more detailed update. But I'd like to talk about some of the important steps that are already being taken. The Maryland Department of Health has activated public health surveillance and clinical guidance protocols, mobilizing our capabilities in every jurisdiction across the state. Top health officials are participating on a daily basis with the CDC, in daily briefings with the CDC and federal authorities, and holding regular briefings with local health departments, physicians, nurse practitioners, pharmacists, and universities. And our health department has worked with local hospitals, which have all developed comprehensive hospital surge plans, which will be activated if and when it becomes necessary. The Maryland Department of Health, in coordination with our Department of Education, has been in communication and has provided guidance to local school superintendents and school officials. The team here at the Maryland Emergency Management Agency is coordinating with local emergency managers in jurisdictions all across the state, and will be bringing together leaders from all state agencies for a comprehensive tabletop exercise. I will be convening my entire cabinet tomorrow for another detailed briefing. State health officials will be briefing members of the legislature, the comptroller, the attorney general, and the treasurer tomorrow, and our coordinated statewide coordinated statewide preparedness efforts. And our administration is going to submit a supplemental budget, which includes $10 million for emergency coronavirus preparedness expenses. I want to assure Marylanders that our state is taking every precaution when it comes to the coronavirus, because our highest priority is keeping our residents safe. While we are hoping for the best, we are also actively planning for the worst. As the CDC warned a few days ago, local schools and daycares should be prepared with contingency plans for potential long-term closures. Local communities and cities should be prepared to modify, postpone, or cancel mass gatherings, and local businesses should be ready for office closures that require their employees to work from home. CDC officials warn that while this situation may seem overwhelming and that there may be disruption to everyday life, may be severe, these are the kinds of things that people should start planning for right now. We are going to continue to track this. We will be receiving almost constant up-to-the-minute information, and we will continue to coordinate all available resources in the days and the weeks ahead. The public should be assured that our state's preparedness builds on decades of planning, experience, and expertise, which has been gained by previous and ongoing public health events, including the flu type A and B, which is what most people would call the normal flu, which has already resulted in the hospitalization of 3,000 Marylanders, and which has already taken 40 Maryland lives just during this current flu season. We're very fortunate that Maryland has some of the top health research facilities in the world, and I'm confident in our state's ability to respond effectively to potential cases of coronavirus and to be a leader in developing treatments and perhaps even a vaccine. I would encourage all Marylanders not to panic, but to take this seriously and to continue to stay informed. we would encourage you to visit health.maryland.gov/coronavirus. Residents can also dial 211 to connect with a helpline representative effectively immediately to get information and community resources on the coronavirus. And at this time, I'm going to turn the floor over to Deputy Secretary for Public Health Services, Fran Phillips, who will provide more details about the virus and also about the excellent work that is already underway at the Maryland Department of Health. Fran?
Well, thank you, Governor. Thank you for this opportunity to provide details, and also thank you for your continuing leadership as we, as all Marylanders, face this situation and as we continue to stay informed. A couple things I'd like to characterize. As the Governor said, the situation in Maryland right now, as well as across the country, is one that remains at low-level risk, but we are aware and on the lookout if that should change. And so that is the kind of preparedness and mobilization response capacity in Maryland that Maryland Department of Health has been working on for many weeks now with our partners. That's partners in local government, other agencies, other state partners, federal partners, as well as very, very importantly in community and in the private sector. We will continue to keep you informed of all information as it becomes available. To start off with some counts, with some information about where we are in Maryland, we do not have any confirmed cases of coronavirus, the new coronavirus in Maryland. To date, we have now had 4 individuals who have met the testing criteria for coronavirus. Those 4 individuals have, 2 of those 4 individuals have been tested, the test results have come back, and those test results are negative. There are 2 other individuals who just today have met the testing criteria, so these are considered persons under investigation. So their specimens too will be sent to the CDC lab in Atlanta for that testing. That brings us to 4 suspect cases. Again, 2 of those have been ruled out and 2 now are pending. We understand that there may be discussions underway right now for a 3rd individual in Maryland today who may come forward and meet the criteria for testing. That has not yet been determined. So we have a situation not unlike our neighboring states in which we are leaning forward in terms of public health preparedness. And I'd like to give you some examples of what the Department of Health as well as our partners have been working on in order to assure the safety and health of Marylanders. First of all, very, very importantly, is continual communication with healthcare providers, whether that's clinicians, hospitals, or others around the state, so that we have 24/7 intelligence on individuals who may present, who may have symptoms, and who may meet that criteria for testing. Our public health laboratory, it's a state-of-the-art laboratory in Baltimore, is ready with trained experts as soon as we receive from CDC the materials as well as the clearance to go ahead and to be able to do this testing on our own right here in Baltimore, which will save some time. Our information technology department has worked very closely on software platforms so that we can monitor individuals as needed in their homes using remote technology so that we can keep an eye, a virtual eye, on people who may or may not be developing symptoms. Our preparedness and response team has been working very closely with every hospital in the state, with other healthcare providers to understand exactly what their inventories are as far as very essential supplies, whether that's supplies to treat patients or, importantly, personal protective equipment, those kinds of supplies to make sure that healthcare workers are safe and that other patients are safe. As I mentioned, our local health departments have stepped up 24/7 lines in every jurisdiction. So if there should be a case at 2 o'clock in the morning anywhere in the state, there is an individual, a trained clinician who is available 24/7 to take that call anywhere in our state. We've worked very, very closely, as the governor said, with local school systems as well as universities and colleges in Maryland. We are blessed with terrific academic institutions who have come forward on their own and developed communication and preparedness plans for their academic community, for their students as well as their faculty. We are engaged very closely with federal partners on making sure that travelers who have come back from concerned areas in the world, particularly mainland China, who have come back to Maryland, are screened, and they are screened to be safe to return to their homes. And when they come back home, we continue to stay in touch with them for the duration of their quarantine period. And again, we have found remarkable cooperation across the state from those individuals. Lastly, we are developing contingency plans in the event that we have a number of people who are not able to be maintained at home. So we are developing partnerships, contractual arrangements for alternative housing, for transportation, and for support services if we need to take care of people outside their homes in other kinds of facilities. I can tell you daily briefings with multiple federal agencies so that we are on top of the latest CDC guidance, which is evolving, as is the outbreak. We are in frequent calls with state health leaders in every state that touches Maryland in the surrounding area. So while we're very, very busy at the state level, there's some steps that I want to remind Marylanders to take to protect yourselves, protect your family, and to get ready in the event that your lives may be disrupted for some limited or perhaps for some longer period of time. First and foremost, stay informed, and do that with reputable sources. So cdc.gov, reputable source, health.maryland.gov. That's the homepage. You don't even need to go to /coronavirus. So it's health.maryland.gov is another reputable source from the State Health Department to stay informed. You know, the governor talked about flu, influenza. The way that this new coronavirus is spread is exactly the way as influenza is spread. So I want to say it one more time. Don't stop washing your hands. Wash your hands frequently. Cover your coughs. If you are sick, please don't come to work. Do not send your children to school. Avoid touching your face, touching your eyes. These are ways that viruses that may be on surfaces can be transmitted to us. So those are some of the basic preparations that we all need to be aware of and to implement in order to protect ourselves from regular flu as well as from this new coronavirus. It's also a good idea now to think about preparedness for your household. For you, if you need to stay home with your family, what would you need to maintain yourself for a period of time? So a home preparedness kit, not unlike what recommendations are when we feel that there may be a storm coming and there may be some people who are temporarily remaining at home. So there are things to keep in mind, pain relievers, alcohol-based hand sanitizers, thermometers, non-perishable food. If you have pets or children, you might want to think about stocking up on extra pet food or diapers. There's a list of those kinds of household preparedness items on our website. Again, that would be health.maryland.gov. What we know about the vaccine, about the virus is evolving. We know that there's not a vaccine available, and we know that there's not a medication available. So those are two ways that this new virus is different from influenza. But again, we are learning every day more about how this virus is transmitted and how we can take steps to protect ourselves. It's not too late one last time to get a flu shot. I will tell you that we have many people who present in urgent care clinics, in doctor's offices, in emergency rooms with flu-like symptoms, and they have the flu. We have tested them and they have the flu. So this is still a period in Maryland where influenza is widespread, very, very active, and as the governor said, influenza can be a very, very serious disease, particularly for people that have underlying health conditions. What we have learned from the information coming from overseas is that it looks like the new coronavirus may disproportionately impact people who have chronic illnesses such as diabetes or cardiac problems, and may impact disproportionately older people. So with that, I wanted to keep you informed, and I appreciate the opportunity to share with you some of the activities just there within the Department of Health, and certainly with my colleagues across the cabinet, the level of readiness and preparedness that we are committed to in order to keep Marylanders safe and healthy in the future. So with that, I will stop here. Thank you.
Thank you, Fran. With that, we'll take a couple of questions from the media. That's a good question. Fran.
Yeah, thank you. The specimens are flown overnight to Atlanta to the CDC lab. We've had experience now with 2, and we'll send 2 more today. The experience that we had took between 2 and 3 days to get those test results. And so during that period of time, for individuals that do meet the criteria, we do ask that they are quarantined at home and stay away from others until we get those test results. We are hopeful that in the next week, CDC is not specific yet as to when we get the clearance that we need in order to do the testing much more rapidly here in state in Baltimore.
Can you clarify also, there's a lot of confusion and there's a lot of concerns
Yeah.
how this all plays out as far as the virus is concerned. If you were to get it and you were a healthy individual, would it be the same thing as kind of riding out the flu?
Yeah.
Or there really hasn't been a clear picture on that, and people are starting to talk. I don't know if you use the word panic, but like people just don't understand how this works. I mean, if you're healthy and you get this, the survival rate is still very high. Is that not correct?
Well, you're asking really good questions, and for that you would need a lot of information that we don't have yet from China in particular, as far as exactly how many cases were experienced in this last 2 months, and against that denominator, so to speak, how many people actually had to be hospitalized, how many people actually had lethal conditions. So we don't have that information available at this time. What we are seeing is that more and more of the people who are very ill, and not to say that this is exclusively the case, but people over the age of 60 seem to be disproportionately impacted, hit much harder with more severe disease, as well as I said, people with underlying health conditions.
Sure. Yeah, so we're submitting a supplemental budget that will include a number of items, including $10 million that we are just using as a precaution because we believe that we're going to need additional money to potentially pay for some of the things that we're talking about. And so we're submitting that to the legislature. Anybody else?
Talk more about the plan if we do have a quarantine situation. We saw the cruise ship situation over in California. How is the state ready to respond in those sort of situations where you might have a large group of people that need to be quarantined?
Well, I'm not sure we're going to get into a lot of hypotheticals. It will vary on a case-by-case basis and how widespread and exactly where this took place. But those are the kinds of issues that we do have plans on for, and we've had those discussions about whether this happens at an airport with respect to somebody coming on a plane, whether it's happening at the port where we have people coming on a cruise ship, whether we have situations where you have an individual quarantine or a wider spread quarantine that might be in a community or a school. So there's a lot of hypothetical situations that are dealt with in our plans, but it's not something that we want to speculate on at this point because we don't have that issue quite yet. Anybody else? All right, well, thank you all very much. Wonderful job.
Thank you.